Now, 527 health leaders from Nigeria, from every state, and we're going to share with you the number of LGAs represented a little bit later, are registered for today's session. And we do want to explain how we're going to be honoring contributors. So if you have attended these assemblies taking place every Monday for the last 4 weeks, you will be recognized as a contributor and co-founder of the Nigeria Immunization Collaborative. Now, why are we recognizing and honoring you in this way? On the 17th of June, just 23 health leaders from Nigeria had shared the invitation with your colleagues. By the 17th of June, you had reached 29,945 fellow health leaders. By the 1st of July, 44,945 health leaders. Last Monday, 56,195. And today we're pleased to announce that the number currently is that you have shared, reported by Nigerian movement leaders, 65,320 of your fellow health workers, health leaders reached. Now that's not all. 101 of you have shared with colleagues and taken the time to tell us about it. And so we really want to acknowledge and honor you. You can see the names on screen. There's 101 names, so unfortunately we're not going to read them all, but we hope that you will recognize your name. And of course, if you wish to see your name on this honor roll, do take the time to share and then let us know who you have shared with. That is really the key. Again, we went from on the 17th of June, just barely a month ago, 132 health leaders from Nigeria had expressed interest in the collaborative. By the 17th of June, 226. For every 226 reached, one had expressed interest. Then by 1st of July, 699 had expressed interest. And by last Monday, on the 8th of July, we were up to 1,615. But then something remarkable happened. And that is very quickly, just in the last 7 days, we went from 1,615 to 2,711 health leaders from Nigeria who have expressed interest. That is not all, dear colleagues and health leaders. The same chronology when it comes to organizations becoming partners of the collaborative. A month ago, there were just 12 organizations that had said, we would like to be partners of the collaborative. And you can see last week, there were 81 organizations. And once again, you have done it again, Nigerian colleagues. 166 partner organizations. You can see the names here. We hope that you recognize your name, because we ask each of you to confirm that you have the authority to commit your organization. Do not get confused. If you do not represent your organization, you cannot declare it as partner. So these are the individuals. You see the names of the organizations and the individuals who have said that they are committing their organization and that they are authorized to do so across Nigeria. 166 partner organizations. So we'd like to mark a pause here and go back to Charlotte. Charlotte, we'd love to hear from one more health leader from Nigeria why you want to join the Nigeria Immunization Collaborative.
Okay, Reda, so I'm inviting Catherine, Charles. Your hand was raised. Please go ahead, Catherine Charles Obiora. Can you unmute yourself and share why you want to join the collaborative? And do start by introducing yourself. If not, I'm inviting Rabiu Abdul Wahab. Many hands are raised. Okay, Paul Balogun, over to you.
And so if Charlotte calls on you, do unmute yourself, yeah, and be ready to speak. The collaborative is about your participation. It's about you.
Hello, can you all hear me? Hello, this is Paul Balogun.
Yes, we can barely hear you. The volume is quite low.
Increasing the volume.
Much better.
Okay. All right, can you all... Okay, thank you very much for this great opportunity. My name is Paul Balogun, calling from Gombe State, uh, part of Nigeria. I am delighted to be here. Reasons why I want to join this is to join hands together because I work with so many people in the hard-to-reach area, remote areas, so that we can pass this message across to them and they can be able to issue of lack of immunization may reduce from our own angle. Thank you and over.
Thank you, Paul.
We also ask you to share your experience, and we honor contributors who have already shared their experience. We ask you, just you heard Paul's answer, but you'll see so many of you have already answered these questions. Questions like, why do you want to join? What is the biggest immunization challenge that you face? And by the 1st of July, only 18 of you had answered the first question. Last week, it was 140. And today, it is now 273 members of the collaborative who have already shared their insights. And remember, we have not yet started the collaborative. We are kicking off the collaborative Monday, 22nd of July. We've received applications from 33 states, and on 1st of July, it was 71 local government areas that were represented. Last Monday, it was 171 LGAs, and today 36 states are still represented, of course, but we're pleased to announce that there are 239 local government areas that are represented within the collaborative today. There's 3 screens now, and I believe it will continue to grow as we urge you to invite your colleagues. Don't let them miss out on this. They will be sorry if they miss out on the collaborative. Now, we also ask you, of course, questions, more substantive questions. For example, across Nigeria, what are your 9 top challenges? And you can see here that it's very much focused on adults and children missing their vaccinations, reaching zero dose and children, and missed communities are the 2 top items. Next is disruptions to routine immunization, introduction of new vaccines. A call to the women in the collaborative. Charlotte, what would you like to say to women in the collaborative and supportive men as well about the fact that less than half of the collaborative so far is made up of women?
Thank you so much, Reda. We know from global statistics that more than 70% of the health workforce is made of women. And we know that most of those involved in immunization are actually women. So it is but normal that we should have more women joining the collaborative than men. So I'm shouting out and giving a call to action to all the women that are here. Please invite our sisters to join the collaborative, and also to the men that are here, please invite the women that work with you in your organizations, in your health facilities at the state level. Encourage them, support them so that they are able to join the collaborative. Thank you, Reda.
Almost 40% of you work for the government, and the remainder you can see are spread across country partners, civil society organizations, Red Cross, Nigerian Red Cross, Gavi, other global partners. That is a healthy mix from our perspective, but this is the collaborative is in partnership with NPHCDA, and it is to support the government's efforts and goals. Now, you know this is about Immunization Agenda 2030. Immunization Agenda 2030 is the world's strategy for immunization adopted by Nigeria and every other member state of the World Health Organization. IA 2030 has 47 different key focus areas. And when you defined your challenge, you told us what is your local challenge where you work that you face. We asked you, well, where does it fit into IA 2030? And you can see that the top level responses are immunization, primary healthcare, public knowledge and understanding, acceptance and value of vaccination. Now, if you're joining for the first time, we urge you to go now to learning.foundation Nigeria to learn more about the initiative and to express your interest.